Well, hello, everybody, and thank you for joining us on the We Are TechBritannia show, and so podcast and video. And I'm delighted to be joined here today by Mark Hinton, who is the Chief Technology Officer for Lucida Medical. Hello, Mark. Nice of you to join us.
Hello, it's very nice of you to have me here. Thank you.
Fantastic. Well, perhaps you could give us a bit of an insight into what Lucida is, what it's doing, and also what your role is and your background. Could you maybe kick off with a little high-level view of what Lucida Medical is all about?
Absolutely. So we're a Cambridge-based startup using artificial intelligence, and our focus is on medical imaging, and in particular MRI. So it's where you get pictures of that kind of like the inside of your body in 3D. We take those images and we use the latest machine learning models to identify and assess potential cancers in a patient. Mm-hmm. And we use that to support radiologists so they are better at detecting the cancers potentially, and it just gives them more information to understand how serious the cancer is and what the next stages should be. That's essentially what we do. So we have a team of very smart machine learning engineers. My role as the Chief Technology Officer is apparently to look after them and keep them doing the right things. We are a young company, so most of us, we've grown very fast. We're now about 10 or 12 people. At the beginning of the year, we were one person.
Wow.
And so we've grown very fast. We have got our software approved, so it can be used in clinical practice. And we have partnered with GE. They have an accelerator program helping startup companies, AI companies in the healthcare sector to integrate into hospitals and clinics. So we're working closely with them, and they're supporting us in how to do the integration, because it's, as you might expect, it's a hard task to create a very smart piece of software that can do things that a radiologist does, and it will help a radiologist do some of those things faster or better. And then it's a whole other thing to be able to make it usable, to be able to put it into the hospital, that the radiologist can have access to it, the radiologist knows how to use it, all of these things. And that's where we are partnering with GE to build that part of the technology. Now we've built the core part, which does the clever stuff. And then we have to do the other bit of clever stuff.
Fantastic. Well, that sounds like quite a fantastic challenge for a CTO. So you've been with the company for 5 months, and obviously your background is in technology, in imaging. Perhaps you could just give a little bit of an overview of how you've got to be at Lucida, and then we can look at how things will be moving forward, and perhaps a little bit more about how things are going on the accelerator and what you're picking up from that.
Absolutely, yes. Yes, as you said, my background is in technology. I'm actually a physicist and a mathematician originally from academic days. I've been around a long time. So I've worked in multiple industries. It's been the last 10 years or so that I've focused on life sciences, and in particular on advanced imaging and the use of algorithms and, again, machine learning to interpret those images and to get more out of them. So that's helped to bring me to Lucida, because I would be one of the kind of few CTOs that already understands how MRI works, that understands, or to a certain extent, that has worked with imaging, that has worked with machine learning, and has also just worked on general enterprise level software using the latest technologies. So I've applied my skills in the past in investment banking, in transport logistics, in aerospace. So I can bring experience from outside, which is always useful, I think, to get understand the way the same sorts of problems might have been solved in a different industry in the past, and bring that to bear now. So that's what's brought me here. That's why I think I can do a good job. And of course, it's about growth. And I have a background in startups as well. helped to take startups from conception through to exit in both life sciences and again in other industries. So it's a broad brush that I bring, but hopefully also with the people and management skills to build a young team very quickly. We have a very young, diverse team. The only things they have in common really are that they have this passion for technology, machine learning, for clinical advances.
Well, also in a challenging time to be building that team as well, because I should imagine you've not had an opportunity to spend any time together. And diversity is important, I think, within this kind of environment, particularly because you need those different viewpoints to work on stuff like this and be as effective as possible.
Yeah, I mean the current state of technology, such as we're using now, has been absolutely essential to do anything. We do miss the opportunity. Well, I say we miss. I think we know that we miss the opportunities to be together in one place, with flip charts and post-it notes to really brainstorm the designs and algorithms. I would say we've never actually done that in this team. So there are. Actually, I have physically met pretty much everybody, but from March when I started until the last couple of weeks, and yes, people I know get to know people very intimately on Zoom and Teams, but not physically met. In fact, I started my position when I was in Brazil. So from the first 6 weeks or so, I was working from Rio and from the northeast of Brazil. So we can do it.
I noticed that on your LinkedIn profile. So I wasn't sure whether that you were actually based in the UK working on that type of stuff. So, but I mean, that's the way things are going. And there are lots of people in reality, we all know now that you can still be incredibly effective without physically being anywhere. Although I think we are about ready, aside from all trying to gather for football matches, also looking to spend more time together to bring that social interaction back into things. So you guys must be looking forward to doing that at some stage to bring people together.
Yeah, I think every company has to work out, or every organisation is working out how to do that, as are we. I hope we don't. Yeah, I don't think we will have everybody in the office every day ever. We will always have an element of remote working now. I mean, if anything good has come out of these last 15 to 18 months, it has been that we've demonstrated beyond doubt that you can work remotely. You don't need to be at your desk in the office to be productive. You can be at your desk in your kitchen or dining room or spare bedroom and be productive. That's proven beyond doubt now, I think.
Yeah, and it's obviously brought some benefits from a work-life balance perspective for a lot of people. Although I think everybody is kind of keen to get back in a bit more, perhaps. So yeah, so a hybrid seems to be the direction.
I think a hybrid thing depends a bit upon what your commute is like. If you live close to the office.
Yeah, in Brazil, I probably wouldn't want to come in a couple of times to the office if I was in Cambridge.
No, I mean, well, quite, yes. It was a bit of a, it would be a bit of a trick.
Wouldn't be, yeah, you'd be complaining. Although you catch up on a lot of reading, I guess, on the plane. But there we go. So you're focused on MRI imaging. You're focused on, obviously, both the diagnostics and obviously looking at the progress of treatment and hopefully, that treatment being successful from an MRI perspective. Are there any particular cancers that you're focused on? I mean, does that make a difference to the AI? Well, how does that all fit together?
Yeah, so our first product is focused on prostate cancer. So it takes prostate images, again, obviously, and processes those. We are working on other cancers in as we launched that one, then our development program is looking at other cancers, and in particular, we're looking at a thing that's called whole body MRI, and it's actually imaging from kind of about the base of the neck down to the thighs, kind of thing. So you get an image of the whole body, and then you can look to identify cancers in the lungs, liver, kidney, pancreas, and also in bones. Quite a lot of cancers spread from the organ to the bone, and you get bone metastases, as they're called, and they're quite hard to pick up in MRI, but we're working on doing that. So that's very exciting for us, because that could be a whole body screening MRI that people could have, whatever, once a year, or when they get to a certain age, and at certain age trigger points, just go and have it. It would take 30 minutes. There's no radiation associated with it or anything, and then you get an analysis, of all the organs that are most likely and to get, to become cancerous. And the key thing here, of course, is that the earlier that anything like this is detected, the much, 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 much greater chance of survival and full remission is. So that would be a great. It's not that we haven't got that yet. I've stressed that, but that's something that we're working towards, and that would be one of the visions of the company long term would be to be able to offer that kind of a service.
And that aspiration obviously has to be important. I think one of the things that I know personally I was involved with was Bites for Heroes, which was in the early part of the pandemic, when we were looking at tech supporting the NHS and doing a bit more than a clap on a Thursday evening. And we did some work with Royal Marsden around that whole, element of that, and certainly we were seeing that there was, I'm not saying that the Royal Marsden was saying this specifically, but I think that the general understanding is anything of the scale of a pandemic is going to impact all other aspects of treatment and diagnosis. So anything that we can do right now to help speed up that process from identifying an issue right through to ensuring that you can spot whether things are working or, hopefully working or not, the better. So you're starting with prostate cancer. Obviously, that's a big theme in the tech industry. On a personal note, because obviously we still are, even though you talked about diverse teams, there is shall we say, a bit of a slant towards gentlemen being part of the tech environment. So obviously it's important on that level as well. I personally have been impacted. My father died of pancreatic cancer, and unfortunately by the time they were aware, it was way too late for him, and it's a long time ago. But anything that people can see that will have a positive impact, and basically what you're saying is, AI is not here to replace what's happening in the radiology department right now, but is to augment and stand alongside what's happening there.
Absolutely. I mean, I think it's very much, it's a bit of an old phrase, but it's a balanced scorecard assessment, I think, in the way that the technology impacts. There were some hard, there's some hard financial things. If you can choose a cheaper treatments, then you save money. They're still going to be effective because you're using AI. But there's also just the general quality of the outputs from the radiologist, if they can be improved, or if you can use AI perhaps to help the less specialist radiologist. So we'll have hospitals where a radiologist may only do a handful of prostate examinations per year, even, and then there'll be other radiologists in more specialist hospitals that might do 1,000, even 2,000 in a year. So obviously, the one that does 2,000 a year is very good. You just get better as the more of these things you do. And the one who only does a small number they might not be quite so good. Then if technology like ours can help them to raise the quality of the reports that they produce and the findings that they get, then that's a very cool part of how technology can help. But definitely, yeah, we're a decision support system rather than a decision making system. It's going to be a long time before you go for an MRI scan, and either with our software or any of our competitors, automatically without a radiologist looking at it or without an oncologist looking at it, you'll get a message saying you're due for this treatment because of the results of your scan. That's a long way away. Hopefully, actually may never happen.
Yeah.
So it's more, it's definitely supporting the radiologist, making their life easier. It is about productivity, and if today a radiologist takes 20 minutes to report on an MRI, and using our software they could do it in 5 minutes. That obviously sounds good, and it actually is good, but from the poor radiologist's point of view, he may just be asked to do 4 times as many reports as he currently does, because ultimately trying to reduce the number of radiologists, which might be a good thing if we actually have a big shortage of it, but simply churning out more reports without improving the quality, without having good quality control checks, I don't think it's actually a great help. But producing better reports in the same time period or a bit less, I think that starts to add up to a lot of savings. Or if it frees the radiologist up to do other things that they do.
Well, that's where looking at other aspects of, if you talk about potentially automation as being something in this area, but something where because what I understand is, and I think this is an interesting concept, because the radiologist will look at the bigger picture, whereas anything that you're producing at the moment, from what I understand, and please correct me if I'm totally wrong with this, is that it will look for one thing. So it will look for the prostate, for example, and it will go, put all the things together and go, right, that's an issue that needs to be looked at, because effectively it's like alerting people. But all of these things, as you say, particularly I would have thought with the complexity of this sort of like from neck to thigh, there's a lot of information that you're going to be looking for there. And particularly with something like that, there is going to be a need for that human element very clearly to look at all aspects in the diagnosis and the wider landscape. I'm afraid I'm a bit of a fan of house. And we all know that part of the problem with diagnosis is that you always assume that it's one thing that's wrong. As soon as there's another thing wrong, he was always very good at looking at the bigger picture and going, yes, you've got all these weird symptoms because you've actually got 2 different things that are causing the problem. So, and that's life. It isn't just please take a ticket for your illness. You get whatever you get, and that hopefully is the minimum amount, and nothing, ideally. But obviously, we want to ensure that type of engagement with the medical profession gives the medical profession the best chance of diagnosing you as a human being, not just as one particular illness or condition.
Exactly. Yes. And there's a whole discipline out there, called health economics, which tries to look at all of those, take lots of factors into account to understand what the overall economic impact of introducing a new technology or new processes or new drugs or whatever it might be. So not just how much does it cost per patient, but everything that comes out of that, both money saving and societal.
Yeah, exactly. If we have healthy, happy individuals, we should be a more productive nation, or at least they always say that if you're happier, that you're a bit more productive. So I don't know. I like to think that's the truth. I don't want to be miserable and very productive. Yeah, absolutely. Please send me some statistics that actually say that's correct.
I can imagine there might have been a bit of a lack of productivity earlier today after people had a few more beers after the football match last night.
Oh, yeah, well, I'm alcohol-free at the moment, so it definitely wasn't me, but I was in a pub last night, and I have to say, yes, there was a lot of happiness, shall we say, sloshing around with beer glasses at the time, and a lot of running around as the. Although I was very happy, I did predict the score. I did say that Denmark would score twice and England once. Of course, but I didn't realise Denmark was...
You got it the wrong way round. You got it exactly the wrong way round, but very good.
No, I didn't, because Denmark did score our first goal.
Oh, well, that is true, yes, all right. Okay, it was an own goal, yes.
Yeah.
Okay.
Although Sterling did do a good impression of making it look like it was him, yes. In fairness, but you're doing a great job, lads. Keep up the good work. So we've just time-stamped ourselves to when we're recording this. I'm not sure we'll turn it around. Hopefully we're still smiling when we're thinking about football. We've looked obviously at this, the medical side of things, and you mentioned very briefly earlier that you guys, first of all, that you've come on board and there's been, the team has grown hugely. I mean, exponentially from 1 to 12 in less than around 6 months. That's huge. Obviously, getting onto an accelerator program. I believe it's the Edison Accelerator Program run by GE.
That's right.
And obviously, GE are big in imaging, so hence there being a great fit. So tell us a little bit about the support that you're getting, because I did go and have a little snoop, and you've talked about the technical element of it, but obviously it's exposure to GE's client base as well, which is going to be...
Hopefully so, yes. So, in terms of practical support, they have programs we can join and are part of around defining the market, whole marketing processes, sales. That's useful. I mean, I have some experience in this, but you can never know too much. Yes, and we will be trialing the software. It's demonstrating the integration with hospital systems through them, working with them. So they provide the plumbing, as it were, into the hospital systems, and we provide the AI solution and generate the reports to be sent back. So that goes on during the program. We will demonstrate the technical feasibility of that part, but then that also puts us in touch with the hospitals that we're working with, that GE are working with. So we're talking to radiologists there, we're talking to their project managers. So we've got that introduction to a very significant NHS trust, and it will be a showcase for us so hospitals will see how it will integrate, what they need to do, what they get out of it, and hopefully, at the end of that, we've got a case study that we can demonstrate to people. They can see how well that's performing, and that supports us with other work we're doing around further validation of the software. So getting more and more real world cases that we can process, and with historic data and effects that we can compare with what the actual outcome was. So we're actually trying to predict the cancer, or basically trying to predict the cancer and at what stage it is just from the images, rather than having to do a biopsy, which is, so the imaging is not intrusive. The biopsy, obviously, a needle goes into you and some tissue is removed. So that's much better for the patient not to have the biopsy, and the biopsy is expensive. So it all dovetails together for us.
Well, yeah, because you'll send it to a lab, somebody's then going to look at it in the lab, whereas this can be effectively instantaneous, couldn't it? That this would.
Pretty much, yes. I mean, at least in a few seconds, which is pretty much instantaneous for.
That would do for me. That's instant. That's faster than I can make a cup of tea. So that's instant in my book.
Exactly. So yeah. So yeah. And it gets us exposure as well. We are being introduced to people. People are hearing about it, and that's it's just raising our profile, and it's just very positive all round.
Yeah, is that going to, because obviously GE is a global brand, is that going to give you exposure beyond the UK as well through their network?
Definitely, yes, definitely. So GE is particularly strong in the United States. The United States obviously is at the moment is the biggest single market for what we're doing. And GE has a lot of presence there. So we have to. So there are other lots of information systems in a hospital. There's the systems that store all of the medical images. We need to be connected to that. There's a system that has the individual patient records, and we need to be able to get some information out of that. It's like the results of blood tests, that sort of thing. And there's a system that manages the imaging process, that has, manages the appointments and where the report will go from the radiologist, and we have to have integration to that. But in many hospitals in the US in particular, and quite a few in the UK as well, all of that will be supplied by GE. GE have solutions for all those things. So then we have, in a sense, easy access to those hospitals. So, and if GE, and GE already there, as they're already their customers. So if they promote us kind of thing as an add-on for their things, then that can be a good and effective route to market potentially.
Definitely a very good foot into the lab, I suppose, or foot into the radiology room.
Yes, it's a very good. It's a very good link in. Yes. But obviously we need, and we're also learning, just generally how you have to do that. So for hospitals that are not GE, providing anyway.
I'm saying that. So how long will you be on the programme for? How long does it run for?
Oh, it runs until about the end of the year. It's about there's an onboarding process we're now underway. We're fully functional it's about 6 months.
Oh, okay. So it's early days, but you're obviously hopeful that this is going to be a very positive.
Oh yeah, it's already positive. Yeah, it's already doing good things for us. So.
Great. And what else can we see coming out of Cambridge or wherever everybody is throughout the UK right now? What kind of stuff do you want to say? Anything more with regards to the AI and machine learning aspect of it? Because obviously that's a very interesting area. I know that this can be a bit of a contentious subject from an ethical perspective, and obviously the medical profession keeps a very close eye on such things. I think you've obviously mentioned that this is not designed to replace human view of information, but to really provide additional eyes, effectively, even if they are not actually human eyes, to kind of identify things and speed things up, and maybe spot things that don't get spotted by the human eye.
Yeah, I think. We have a vast amount of data being collected and has been historically collected, and the process is being gone through to really understand that data, to make it accessible to research companies, to companies like ourselves, but in a correct way. So to comply with ethical considerations, to comply with GDPR, to make sure to have the data with informed consent. And of course, we know there are some political things going on at the moment around GPs' data and whether you have to opt out of that data being potentially used or not. But that's a short-term sort of moral political challenge. Obviously, we don't really have anything to do with specifically. But those will be overcome, and then we're going to see more and more data available, and then the use of machine learning to look across that data. There's a phrase multiomics, to look across all of the data, the genomic data, the radiomic data, so data taken from images. There's other omics. There's within the thing, proteomics, where you're looking at what proteins your body produces, that kind of stuff. And this becomes a vast amount of diverse data, different dimensions on the data that you can glean different pieces, you can get different conclusions from. It's being used a lot now to combine, definitely, genetic data, genomics with imaging data in all sorts of diseases, and not just the cancers that we're looking at, but across other neurodegenerative diseases, dementia, MS, across arthritis, for instance, and then some of the rare but terrible diseases, like muscular dystrophy. So that the potential is there to have this much, much bigger picture and understanding of the disease mechanism and the precursors to the disease becoming apparent, so that we can screen people very, very early across a whole range of diseases,
right.
and also perhaps you can address those diseases without expensive treatments, simply by lifestyle, potentially. If you're very prone to a particular, if you're prone to arthritis, then maybe you just make sure that you have a health. Just make sure. Maybe part of it is to make sure you have a healthier diet with lots of olive oil and oily fish and lots of fresh vegetables, and you avoid you really, even more than normal people should, avoid the processed foods and high salt and sugar content foods, which might well help. So there's a whole way in which we can help society, to understand where everybody's at and what's the best thing to do. And of course, that covers that comes with great risk as well. I mean, one of the things in particular, of course, if you're in a health insurance-led country, then knowledge about your genetic disposition or what the imaging says about your likelihood of contracting certain diseases going forward kind of smashes your health insurance premium if you're not careful, if that's allowed. So there's a lot of moral stuff that needs to be worked on in.
Well, I don't like that last bit. I think that there will probably be some things stepping in to say, sorry, that's just an indicator for me. And if I'm addressing it, then it's not really relevant from a health insurer's perspective. Not that I'm concerned myself, but goodness knows what comes up on my early warning system.
Yeah, well, we have to see. I mean, it's, but it needs to be thought about as we go through these things.
Yeah, exactly. But it does sound like the whole AI and machine learning element could be really very instrumental into accelerating the preventative versus the having to deal with once you have those diseases, which obviously would be great for the individuals involved to make good choices, informed choices, I think is probably a better way of doing it. Saying you're about to hit your threshold for this, you might want to steer things in this particular direction to remove that issue somewhat from the likelihood of you being impacted severely by it.
Yeah. I mean, and I think even just being able to put people onto some kind of surveillance. So, already we have programs where certain people, often because of family history, will be, will have MRIs or will have mammograms on a regular basis. But with machine learning, this kind of data, you could target those people much better. So you would not have to have so many people on some kind of active screening program, which would save money. But those ones that were on the program, you would catch early and have a much better options for treatment and much cheaper to treat them early on. So,
a much better success rate, basically.
Yeah, basically it's a better success rate, yes.
Yeah. Which is, I'm sure, from most people's perspective, if that's going to be, unfortunately, the way that the dice land, they would prefer to know that that's actually an issue.
I guess so, yes.
Well, yeah, ultimately, I guess. Anything else that you'd like to share about the overall, not just what you guys are doing, but perhaps the bigger picture with AI and machine learning in the medical profession, or just generally in life? While I've got an expert in this area, I'm going to pick your brains.
Well, I think we're seeing some trends, and I think there's a couple of breakthroughs that will happen at some point in the not too distant future. I mean, the trend is that that we are now a data-driven economy, data-driven society. So there's more and more data, and it's going to be applied in more and more ways, and different machine learning models will emerge to deal with different types of data. There's a whole bunch of stuff has emerged with image processing. So the medical imaging has driven a lot. Driverless vehicles have driven a lot in terms of image processing, image recognition, image tracking. There's a big overlap in terms of the core algorithms. We are still largely at a point where we have a bunch of underlying algorithms, and we apply those algorithms to different scenarios. To image processing, to speech recognition, to object tracking, to classifying people by their browsing behavior. It's like algorithms that fit to those things. But each application is basically unique. We create a host of one-trick ponies. In terms of it being AI, we don't really have AI. We have a whole bunch of very well tuned algorithms to map an input to an output. We haven't got a generalized model yet, but I think that is something that will come along at some point, or a more generalized model, and that will be much more powerful, much more powerful and much more generic, and possibly much more scary. But it won't involve. It will work more like our brains work, and less like a calculator works. I saw an interesting thing with Jeffrey Hinton recently, who was one of the very early pioneers, father of machine learning.
And I think we're supposed to say that he's not a relative, so you're not name dropping.
I'm not name dropping. He's not a relative.
Specifically, like your brother or your dad or something.
No. But he did recently say he thought that the current approach isn't quite right, and he was saying, I hope there's some PhD student somewhere who's looking at the work that I did and then realizing that it's not right. It's not the right way to do it. He's going to come up with a whole new way, and then that'll revolutionize everything. And I look forward to that day. It will be great. I love what we're doing at the moment, but that generalization to solve multiple different problems isn't really there yet, as far as I'm concerned.
We need some new thinking. Perhaps it will be maybe one of your. Can we machine learn that though? That's the question. Could we set a computer the task of working out how to make itself smarter?
It's an interesting question. Well, sort of. I mean, there are models.
Or would it implode thinking about that? Because it would be like, oh no, that's just too much to think about. Sorry, I can't do it.
Well, Google did a thing, Google Go, where they trained the machine to play Go, the game with the squares and the counters, against. They used lots of human matches, the outcomes of lots of human matches to train it, and then it beats the number one Go player in the world over a series of matches. But then Google went one step further. They said, well, that's all very interesting, but we'll have to try a different approach. And they created two machines, and they encoded those machines with the rules of Go, which are quite simple. And then he got the machines to play against each other, and both with the optimizing themselves to achieve the goal of winning the game. So they let them go, played each other a few million times or whatever. And then the best one of those two, which presumably was just random that one got to be better than the other one, played the original machine learning algorithm that had beaten the human player and basically beat it every single time. So, yes, thank you.
There we go. So I think they are possibly the solution to their own problem. So we shall see. Maybe we'll chat about that once things have progressed a little bit more. So obviously Cambridge, we're going to be hearing a lot more about what you're doing and hearing a lot more about some of the progress that's being made in a very important area of the medical profession. So I'd like to say thank you very much to Mark Hinton, who's the CTO at Lucida Medical. Thank you for joining us.
It's been an absolute pleasure. Thank you so much.
No problem. And thank you all for listening and watching to We Are TechBritannia, the podcast that looks at what's happening in technology and biotech in the UK. You can follow us on Twitter at TechBritannia and also find us on LinkedIn, and online we're at www.techbritannia.co.uk. Thank you very much. We look forward to your feedback and hopefully you'll join us again soon. Thank you.